All right, so I'm going to talk a little bit about the manual. Sorry, Kanisha, did you have something you wanted to add?
No, go for it.
Okay. So I think Dan can tell you where this is located on Umbrella. But for those of you, I think some of you may be aware, but maybe some folks aren't. Kanisha and I also wrote an accompanying clinician manual to the entire GSM. And really what we wanted to do here was to give you just like a little bit more sort of background on what are each of the problem areas the guides focused on, who are they for, how do you use them? And really it kind of goes through in detail, like here are the goals of each of these skills that you're using. Here are the required materials that you can bring to make it easier for you, like quickly, like which worksheets do I need? What do I need to bring if I'm working with a parent and or a child? Here are different activities. And again, just like more scripts, but we tried to make it really step-by-step for you. So obviously, as you've been practicing today, you can absolutely just pick up any of the GSMs and just start following it step-by-step and follow those scripts. And then again, adapt into your own language, personalize it as you familiarize yourself with skills or strategies that are not as familiar to you. But we also wrote this accompanying manual for you. If it's easier for you to be like, I'm just going to follow the manual, I'm going to go in this order. Here's what I'm going to assign for homework. Here's what I'm going to make sure to follow up with the family at the next visit. And so we've got lots of recommendations there for like flow and sequencing of the skills, just hopefully as another tool for you all to make using the GSM even easier. So Dan, I'm sure can tell you where that's located on Umbrella, but you should all have access to that. And then how can you use this? How can you think about concretely using this manual, right? So one, if you, again, we know this is sometimes a luxury. If you have the luxury of meeting with a family regularly for short-term treatment, you can use the manual and the accompanying GSM, which we've been using a lot today, to walk the family and or the patient through the relevant guide or guides week by week. And again, use the scripts and directions to make it easier for yourselves. Places where you want to insert your own analogies, your own language, that's great. If there are other places where you're not sure, you want just like a standard, easy go-to language to get you started, you can absolutely use the scripts and the tips that we've provided in the manual. And then we've also talked a little bit about wrap up in the manual of like, okay, well, how do we end each session and set them up for the next session? And also what happens if we're ending treatment, right? Like, so we've just gone through parts of the depression guide. How do I kind of wrap this up, this like brief course of care? So we've got tips in there for that as well. And then if you're having one-on-one meetings with a family and patient, and you know that there are mild, moderate symptoms, again, you can use the scripts from the clinician manual to introduce the different guides to families, whichever one or ones you think will be most helpful to them. And you can, of course, use the scripts that we've provided just to introduce the different skills. So again, it's not so prescriptive that you absolutely have to follow it in this exact format. It's really just to give you guys options if you're getting stuck or you're not sure what language to use, to maybe not have to think about it as hard until you really get going. If I can get my slides to advance. All right, Kanisha, you want to?
Sure. And just a kind of refresher on how to use the guided self-management handouts themselves in your practice. For subclinical to mild presentations, you can always give the relevant guides to families directly through some of those like smart text links that you guys talked about having in your Epic for messages. You can explain the rationale for the guides using those table of contents pages and review the table of contents pages, kind of just like what we did here. And you can ask families to schedule a follow-up appointment with you if they're, having trouble using some of this stuff or still having problems. For moderate presentations, you can encourage families to review the guides with you in sessions and then be sure to follow up with their PCP about how the patient is responding to the treatment. And how to explain the rationale for this with follow-up. So because your whatever symptom is pretty manageable right now, we can start with providing you and your parent with some good tips that can help you cope with your whatever feelings they are. All of these tips are evidence-based, meaning they're strategies that have been tested and proven to be effective through rigorous research. I suggest that you and your parents go over these tips together, or we can go over these tips together and help you try out some of the skills. And it's reminding that this is not the easiest thing in the world, but it's okay. It may be challenging at first to master the skills, but the more you practice, the easier it will get. And then once you have found some skills and activities that work for you, you can make them a part of your daily routine. And you can soon find that you're really good at managing your anxiety all by yourself, just kind of bringing that empowering note home. But if you find that the skills don't work for you, come back to see me and we'll try something else to help you or try some ways to figure this out together. So as some people have mentioned, there are a lot of guides, right? How many guides? How many sections do you give out? The full guide can be used when the child or teen is experiencing subclinical to mild symptoms of the problem focused on that guide, right? A child or teen with moderate symptoms has the therapist to use the guide with, whether it's you or someone else. The family feels confident and enthusiastic about trying a self-help approach. They're not super overwhelmed with other factors that would make self-help difficult, and the family is willing to update you on their progress. Individual modules, like some of the skills we talked about today, whether it's problem solving or how to get stuff done. So the child is experiencing subclinical to mild symptoms of the problem focused on in a lot of different guides, or they've got moderate symptoms and they've got someone to use the guides with. Family is motivated, organized, confident to try their approach. They're not overwhelmed. They understand that they should work through the skills in order and complete one guide before starting the next. And the family understands they should start with the guide focused on the most distressing symptoms and then pull from there. And they're willing to update you on their progress. Say there's a particular skill that a family reports having an issue with, or you observe them having a hard time with. So whether it's like relaxation skills for an anxious patient, or a parent is struggling to get their kid through their well child visit, and you could focus on effective directions. Or say the family asks for specific tips on using a particular parenting or coping strategy. The family needs additional support to work through a guide that could be helpful. So you break it down into chunks and just give them that first piece at a time, and then come back for the second handout and the third, that sort of way. So as a behavioral health clinician, help the family work through the skills one guide at a time. Start with a guide targeting the most distressing symptoms. Use the tips and tricks in the GSM clinician manual to plan your sessions. Read the directions, scripts, and psychoeducation components with the family. Do examples and activities in session, just like we practice break in the breakout rooms today. Give out those worksheets to help with home practice. Review the homework and troubleshoot using those tips before you move on to the next skill. And you can use individual skills as supplements for other evidence-based practice. Like maybe you're doing ACTS with a teen, but they need some help with organizing their stuff because they're wanting to focus on the value of being more organized and effective at school, for example. So you can pull this when you're doing other work as well. Paper or electronic. So I hear a lot of people talking about taking the stuff from Umbrella and putting it into Epic, which is awesome. Ask families for their preference. The guides work okay in black and white. They're meant to be very readable, but they do look best and more fun in color. If families have access to printers, they may want to print, have that electronic copy and print out pieces at home so the kids can write directly on the worksheets. But families who don't have that printer access may want to have a paper copy from the clinic. And a thing to note is that the guides are a little bit hard to read on a phone because there's a lot of writing and it's small. So patients who don't have computers or tablets and are more reliant on smartphones may need to have some paper copies. Also, giving out a paper copy of an individual skill can allow you to help that patient start trying the skill immediately. Like they can take that relaxation script home and do it that night, that sort of thing. Do you want to jump into referrals to specialty care?
Yes, thank you. And so then lastly, we just wanted to make a comment, about referrals to specialty care. And I know some of you, at least in my breakout group, had kind of brought this up of like, which kinds of cases are we most likely to keep in our own practice, from the integrated care model, and which ones naturally are likely going to require some tertiary care referrals, right? So again, in thinking about not only the GSM and this approach and the kind of CBT that you're able to practice within the kind of framework that you have in a pediatric primary care practice, right? This is just a non-exhaustive list of some of the more moderate to severe conditions where you're likely going to, refer a family for more specialized behavioral health support and or medication management, right? So severe kind of presentations of the main disorders we've talked about: depression, anxiety, disruptive behavior, ADHD, panic disorder, OCD, eating disorders, traumatic stress, disorders on the psychosis spectrum, sleep disorders, suicidality. And we're sure you're seeing some handful of this, come across your way, but that this probably is not, best suited for doing CBT within a pediatric primary care practice. We recognize we took us literally right to 12:30. We thank you all for your attention, your participation in the role plays. It was really fun to get to do this with all of you. Does anybody have any last minute questions or comments before we let you all go, hopefully to take a break from the screen?